Good morning, everyone. My name is Leslie Gaudette, and I am president of the Council of Senior Citizens Organizations of BC, also known as COSCO BC, COSCO without the T. So today I am honored to serve as your MC as we gather here to launch the Healthcare Needs Home Care campaign. And I'd like to thank all of you for joining us today. At this time, our collaboration wishes to acknowledge that we join you from a territory located on the traditional homelands of the Hanomanen and Squamish-speaking peoples. Each of the over 200 First Nations throughout BC operate with distinct languages, governance systems, laws, cultures, and traditions. We respect and acknowledge the rich histories of these peoples, their lands, and their waterways as we work to enrich the lives of all seniors throughout the province. It is my pleasure today to acknowledge that this week is BC Seniors Week, in which we celebrate the many and valuable contributions of older adults to our families, to our communities, and to our province. Older adults in this province, and indeed all residents, deserve to be treated with dignity. Our society must also recognize that we have basic human rights that don't diminish with age. At COSCO BC, we are pleased to see the many events taking place in communities across this province. Seniors fairs and the like provide essential opportunities for older adults to mix with all generations and with the nonprofit organizations and businesses to make the connections that strengthen and build better communities for all. At this time, I'd like to introduce our collaboration. It has been a real pleasure to work with the members of this collaboration, which has been so ably led by the Jewish Seniors Alliance, as we join together with the BC Health Coalition, represented by Sherry Payne, the Independent Long-Term Care Councils Association of BC, and we have Lisa Dawson and Faith Anujad, the BC Care Providers Association with Mary Polak and Danny Birch, the Family Caregivers of British Columbia, which is Barb McLean, and Seniors First BC, Marie Noel Campbell. And I would not be remiss, we have two members of our COSCO executive in the board, Dee Whalen and Barb Mikulak. So thank you all. Let's give a hand to everyone. And of course, I forgot to mention the most important people, Jeff Moss and and Margot, who kept us all going together. And I'm just really happy to have been working with this intrepid group. And at this time, I'd like to thank the 411 Senior Center for hosting this event and generously providing space to welcome us all. This 411 Senior Center is a jewel in the crown of senior centers in BC and is very important. So now, may I introduce you to our first speaker, Jeff Moss, Executive Director of the Jewish Seniors Alliance, BC, who has been driving this campaign since the beginning. Over to you, Jeff.
Thank you, Leslie. And thank you to everyone joining us here today during BC Seniors Week, and for making seniors' health and support an important priority. Imagine being 78 years old or so, living alone, and having to choose between your medication and the home care worker who helps you get out of bed in the morning. That's not a hypothetical. That's Tuesday for many households, for thousands of British Columbia seniors right now. My name is Jeff Moss, and I'm the Executive Director of the Jewish Seniors Alliance of British Columbia. While guided by Jewish values to help repair our world, our organization serves seniors throughout British Columbia, regardless of faith, through public policy work that benefits all seniors, like we're here today, community support services, outreach, advocacy, and public policy work. But today is not about our organization. Today is about something much bigger. Today is about thousands of seniors across BC who are being forced to make impossible choices. choices between food and care, choices between medication and care, between rent and care. And when seniors are forced to make these choices, the first thing they often give up on is the very care that could keep them healthy, independent, and safe in their own homes. That's why we're here today, because home care is not a luxury, it is a healthcare basic need. Today we are proud to launch the Healthcare Needs Home Care movement and our website, healthcareneedshomecare.ca. A little over 2 years ago, our JSABC Advocacy Committee launched a policy initiative to eliminate fees for home support services for all BC seniors. What began as a policy initiative has grown into a province-wide historic movement. Today, 7 leading BC seniors health, caregiver, and community organizations from across the political spectrum stand together and united. Collectively, we represent more than 1 million BC seniors and countless families across British Columbia, united by a single commitment: better healthcare for seniors in BC. The last provincial budget moved in the wrong direction, increasing the burden on the very seniors least able to bear it. Today, more than half of BC seniors live on less than $37,000 a year, when 1 hour of home support per day costs more than $10,000 annually. Too many seniors simply go without the care they need. They delay getting help. They struggle alone. They become more vulnerable. And eventually, they may end up in hospital beds or long-term care facilities far earlier than necessary. That is not only hard on seniors, but it's hard on families, it is hard on caregivers, and it places even greater pressures on our already strained healthcare system. Today, more than 13% of long-term care beds in BC are occupied by people who could remain at home longer if they had the care and support. We already know it works, though. In Ontario, Alberta, and Manitoba, they've already made home support free. They have better health outcomes, they help seniors maintain independent living longer, and they reduce pressure on hospitals and long-term care beds. So the question is why? Why aren't we doing what other provinces have already proven works? I don't know. I can't answer why. It makes no sense to me. Sometimes it makes more sense to spend money to save money, and that's just not happening. If we can keep seniors at home, we can reduce pressure on hospitals. If we can keep seniors at home, we can free up long-term care beds for those that truly need them. And if we can keep seniors at home, we can reduce the number of long-term care beds that even need to be built. And if we can keep seniors at home, we can help people age where they want to age. 90% of seniors want to be living at home, in their own homes, connected to their communities, living with dignity and respect. This is not just a seniors issue. This is a family issue. This is a healthcare issue. This is a British Columbia issue. Every dollar invested in home support helps avoid far more expensive care later. The question is not whether we can afford to invest in home support. The question is whether we can afford not to. Today, we're asking every British Columbian to join this movement. Visit healthcareneedshomecare.ca. Send a message directly to your MLA through the link on the website. It's easy, and it takes less than 2 minutes to do. When thousands of British Columbians speak with one voice, politicians listen. And seniors, they hear it too. That they're not alone, that we are all fighting together for their rights and for their dignity. Because every senior matters. Together we could build a British Columbia where growing older does not mean losing your independence. Policy change can and must happen. Home care should no longer be a luxury. It should be a basic health care. Thank you very much. I'm now pleased to introduce Barb McLean, Executive Director of Family Caregivers of BC, who will speak about the growing burden being carried by caregivers and families throughout our province.
Thank you, Jeff. Spend money to save money. Good morning, and thank you all for being here. It's an important topic. At Family Caregivers of BC, our mandate is to support and amplify the voices of family and friend caregivers in British Columbia. Through our caregiver support line in BC, we hear firsthand every day what families are going through when they're trying to care day after day, week after week, and year after year. Family caregivers, there are spouses, daughters, sons, other family members, and increasingly our friends and neighbors. They are the backbone of care in British Columbia. Most are also working. They're balancing employment with an ever-growing level of care. And the impact is measurable. 34% of family caregivers are in distress. That rises to 57% when seniors receive less than 1 hour of home support a day. When support is insufficient, distress rises and rises quickly. Overall, family caregivers provide more than 80% of the care we need to stay at home. That's 80%. Research shows that when caregivers are supported, they're able to sustain care longer. But publicly funded home support is falling short. The wait time to access it is too long. The number of hours you get is too little. Missed visits, rescheduling happen too often, and the cost for middle-income families is too high. And cost is what brings us together today. We are highlighting how BC's policy of daily fees or copays is blocking access to home care. When care needs increase, the fees increase. Caregivers do everything they can to make it work. They adjust their budgets. They take on more and more care. They do it themselves, the bathing, the dressing, shopping, cooking, managing care, appointments, and travel, and more. And on top of holding down a job, which more than 60% of caregivers are working, they're trying to hold it together. Middle-income families who are disproportionately affected by the copay also can't afford to supplement care privately. They just can't afford it. This is the point where they simply can't keep up. They are overextended, they are overburdened, and ultimately long-term care becomes the only financial option. And this is the heart of the issue. What if co-payments were eliminated? Increased access and equity would be possible. More seniors and their caregivers could afford care. Better health outcomes for people who are older and aging. Reduced pressure on long-term care. For example, say $14,000 a year for basic home support, $14,000, compared to $60,000 a year for long-term care. And where would you rather be? And finally, reducing the burden on family caregivers. We would be treating them fairly as partners in care instead of commodities to be used up and discarded when they are too tired to continue. So improving home care is not a single sector issue. It's a shared concern across caregivers, providers, and seniors advocates, and more. The more we network and connect and share our voices, the more that change is possible around home support. And the message is clear. We all, most of us, want to age in place, and we want it to be real. We have to remove the barriers to sustaining home support. Eliminating co-payments would do exactly that. And aging in place should not depend on your ability to keep up the payments for home care as needs grow. Caregivers should not be left to carry that burden alone. This is one of the most immediate and practical reforms available to government. Please join us. Contact your MLA and make home care a priority. And let's start with eliminating that copay. Please contact your MLA. Now I would like to introduce Lisa Dawson. Lisa, there are many champions in the world, and this is one of them, a bright light and a spark. Intrepid, years and years of caregiving for her father. Now, she's not only the chair of her family's council, she's also the president of the Independent Long-Term Care Councils Association of BC. Thank you, Lisa, for everything you have done.
Thank you, Barb. Yes, Barb said that right. I'm president of the Independent Long-Term Care Councils Association of BC, but what is that? We represent the voices of residents and families in long-term care homes across British Columbia, specifically the residents and families and their friends who are part of councils in long-term care. And what are councils? Councils are a group of people who get together, residents get together, families and friends get together of those residents, and we talk and share about our experiences and observations about what's happening in our care home. And we elevate those conversations to our care home leaders. And today we do have regulation in our long-term care home system to support the engagement of these voices so that decision makings will never again be made without the input and feedback from the residents and families to whom they serve. But I'm not here today to speak and tell you all about that. I'm actually here to springboard from Barb's conversation about what it was like to be a caregiver to my dad before he entered long-term care. I never thought that helping my dad stay at home would come down to impossible choices, but here we are. While raising my daughter as a single mom, dad under my care, full-time job, dad needed help transferring, walking safely, bathing, and getting dressed, just some basic things. But navigating home support was a nightmare. Dad is a guaranteed income supplement recipient. In other words, he had no regular pension income or anything of that nature. But he was told that because he had my roof over his head, I was caregiving for him, he was only eligible for 15 minutes of medication support without cost. This is not what he needed. The co-payment for what he really needed was unaffordable, and I could not afford private in-home care support. So sometimes, some weeks, I just took time off of work to care for him, or I didn't buy what my daughter needed. I tried to do it all by myself, even when exhausted. And as a family care provider, I just did what I had to do, and it took a toll on me, my daughter, my work, and our lives. Families are filling the gap and subsidizing public health care, but we cannot replace a public system. As a result, Dad moved into care approximately 5 years too early, costing our system, your taxpayers, over $172,000, and that was 15 years ago. He's still alive, he's still in long-term care today. So this isn't just my story, it's happening across BC. I have examples of other current caregiver stories highlighting the at-home care disparity. Lack of accessibility and reliability of home support is no better highlighted than in Hal. Hal's a friend of a family member's family, and he could not access reliable or affordable public home support on Bowen Island. For a while, relatives took turns coming to Bowen Island. This placed an unsustainable burden on his family. He had early onset dementia, he was mobile, and just needed guidance, coaxing, and oversight for safety. Hal was eligible for home support, but it was hit and miss. Sometimes it came, sometimes it didn't. They had to be rescheduled. There was no continuity of support. His family still had to contribute financially. The family had no other choice but to place Cal into long-term care outside of his community, and he passed away within 3 months. George and his wife, with dementia, represent those elders looking after elders. They, a couple, had a modest income but could not afford the home support co-payments, leaving 2 frail seniors struggling, trying to access community home support alone until both moving into long-term care too early. They lost their home, independence, and dignity. Another example without adequate home support is James's wife with dementia, who repeatedly ended up in hospital. He just needed help feeding, transferring, and bathing her. But home support was not affordable at the level of the current copay, that the level of copayment was set up. They experienced the overuse of hospitalization as their home support. Then there is the hospital-to-home failures. Dennis is a young man I've come to know. He's got mental health issues which prevent him from holding a job or living safely alone. He got sick. When released from hospital, he could not return to his supportive housing as there was no affordable home support. He could not afford the home support co-payment, so is moved into my dad's long-term care home, a further burden on our system so unnecessarily. Home support exists, but it's not accessible when people and families need it the most. That is why this campaign advocates for the elimination of income-tested co-payments for home support, improving reliability in support no matter where you live, and preventing seniors from entering long-term care earlier than necessary. We ask you to visit the campaign website, healthcareneedshomecare.ca. Send prepared letters directly to your MLA. Support the elimination of home support co-payments. I now turn this over to Leslie Gaudet, President of the Council of Senior Citizens Organizations. Thank you all.
And thanks to all our speakers for so eloquently presenting the case. We thank all you as an audience that is growing as we speak. There's so many more people than when I first stood up here. And I thank you all for attending and listening so attentively to the voices of those struggling to make home support work across our province for older adults and their families. Some of the messages our speakers have conveyed include seniors and families deserve to have quality care at home to ensure older adults can age with dignity. Improving access to home support is one of the fastest ways to reduce pressure on our stretched health care system. And finally, we firmly believe that access to home support should be based on need, not income. Eliminating co-payments for home support will allow more seniors to age in place in their own homes and delay admissions to more costly long-term care. We are calling on the province of BC to eliminate home support co-payments and ensure access to care is based on need, not income. So please visit our website and send the letter to your MLA. Before I close, I'd like to give another thank you to Centre 411. Marika is there, and all of your members who are here today. And I'd like to ask at the end all of the collaborating group to please stay for a photo op. And now I'd like to turn the podium over to Chris Harbord, who will take questions from the media and explain the process as you're able, Chris. Okay.
Thank you.
And Chris is over there, actually, so there we go.
A reminder to reporters joining us via Zoom, please raise your hand to enter the queue and state your name and outlet. We'll start in the room. Are there any media in attendance in the room today who would like to ask a question? Seeing none, we'll go to the Zoom online forum now. Any reporters on Zoom who would like to ask a question? Not seeing any, we can take questions from the room.
Yes, is there an OSA representative present today?
Just me.
What is the position of the OSA? I'm sorry. My name is Howard Glick. What is the position of the OSA in terms of all of this? I understand that you're monitoring all the results of this, and I'm very pleased that you are. In terms of the organization chart, does the OSA actually have any power with the legislature in terms of helping out?
Well, I'm here representing the seniors advocate, Dan Levitt, who's unable to be here today, so he sends his regrets. Unfortunately, it's Seniors Week, and he's really busy traveling the province. Yeah, we've issued 2 systemic reviews regarding home support services, and we continually recommend to government to reduce the co-payment or eliminate the co-payment and just generally make it more affordable. So it's work that we continue to do on an ongoing basis.
But I mean, actually, who do you actually report to, and is it done on a regular basis? Because we know that it's much cheaper in terms of home support than it is to put somebody in a long-term care facility by quite a bit. Up to 4 to 5 hours a day is cheaper in terms of home support than it is to put someone in a long-term care facility. So who's actually the OSA, who's actually your report relationship to?
We report through the Ministry of Health, and that is who we've targeted our recommendations regarding home support towards. Any other questions in the room?
Hello, everyone. I have such a chance to meet everyone today. So much, that gentleman mentioned about the rocket high senior citizen rent. True, because the senior citizen rent now is almost $1,600 to $3,000 for one bedroom with a bathroom. So we must solve this problem. But solve this problem is not the problem of the long-term care organization. That's our problem. This gentleman, would you come to meet me? We can talk about that, because I am organizing about this problem project. Everyone just have $0.45 million can solve this problem for 30 years. Besides that, after this guy, until the time go back to senior citizen rest home, he or she has a few $1 million left for himself. Besides, and other senior citizens move into this seat for the money of the $0.45 million. That's a rent. That's a loan and a payback as a rent. This is all I can tell everyone. Thank you.
Thank you for your comment. I would like to just respond to that for a moment, please. And we recognize that the cost of living in Vancouver and the cost of living throughout BC is incredibly high. And the impact that that makes on seniors is very challenging. And so it's for that reason that we are working to eliminate the co-payment system and offer free home support, so that that's one part of the seniors' needs that they don't have to pay for, because we know that rents are high. We know that food is high. We know that every hearing aid or walker or any medical device is high. And so certainly we thank you for mentioning the cost of rent and the cost of living here in order to be able to help support the case for eliminating fees for home support.
We have a question right there.
Sorry.
Thank you. Thank you for organizing these sessions. I'm from Fraser Association Family Council, and I'm with Lisa. As a caregiver of my mother for more than a year, full-time, 24/7, and also my mother-in-law for 5 years at home, and eventually she ended up to the long-term care home. And also I'm with the Family Council and working, trying to collaborate with the management of the long-term care home and the staffs to just provide the environment that our seniors deserve to live in dignity. I have actually two questions. One is the home support. These home support, to me, the details is not clear. For example, when I was taking care of my mom at home, was the condition of the home was suitable to, even if the help was available? The condition of the home is one of the things that the government's supposed to provide, if you want to go that route, provide some kind of budget or help to the family to make the home suitable for the person. And the other thing is, we always talk about the problem. That's what's thing that I'm the director of Family Association, Fraser Association of Family Council. And we always talking about the problem. But what is our action? We don't see a movement. We just say, yeah, this is the problem. Yeah, this one should supposed to be, government should consider. In our long-term care home, we decided, our family council decided to take action. So we draft a letter, we send it to the minister, we send it to MLA, we send it to senior advocate organization. No response from them. And after a long term, we just received a response from minister, very generic response. We are sorry, we don't have the budget. We try to, change the budget, but there is no action. And unfortunately, there is no accountability. There is no transparency with the government when it goes to the senior. And all of us are working in silos. We need to mobilize a movement to be together. I'm hoping that this step you take right now just take us to that direction. Thank you.
Well, thank you very much for the important work that you're doing. We value and appreciate that. I'm going to ask Mary Pollock, the CEO of the BC Care Providers Association, to step up and be able to respond. Thank you.
Of course, my first thought is we should have you leading this campaign, right? That is precisely why we're here, right? Because one person, another person, this is going to take a multi-layered approach. So the organization itself, we've got, I understand we have a submission going to the Budget Committee with Government. We will have continued advocacy initiatives aligned with this. You can see all the organizations, all our members, and what you've heard the speakers say is talk to your MLA. Now, don't tell anybody, but I'm also a recovering politician. I think it's a chronic ailment. My daughter would say so. I say that because everybody, you see politicians on TV and the minister, they're still people and they still respond to what people respond to. Not everybody can go into an MLA's office, but many people can. And you can make an appointment and sit down. And one of the things we want to do as organizations coming together is support everyday people in their advocacy, giving them the information they need so it doesn't feel so intimidating. But maybe if you can't go to the office, you can write an email, you can send a physical letter. But it is that collection of voices all together. Why? Because we do live in a democracy. People want to get reelected, and they know that seniors and their families vote. So let's make this for our families, for our senior loved ones. My dad's 97, and he's in long-term care. Let's make this the issue that those people are choosing to vote on. And I will tell you this as well. We haven't decided this. But I'm sure one of the things we will talk about as a group, because we're not planning on disbanding, is when it comes to election time, guess what? We're going to be talking about this and we're going to be asking candidates what their view is, right? So stay tuned, stay involved, and we're here to help you. We're here to make it easy for you.
Tell them what you've done already.
I'm not sure if there's any other questions first. There's a question over here. Howard?
Tell them what you've done already.
Oh, okay, let me just go to somebody who hasn't asked a question yet. I'm happy to answer the steps that we've taken to get to this point for sure.
I'm sorry I'm late, but traffic out of Richmond was horrendous today.
That's another issue for us to take up.
And are you also focusing on the federal politicians as well? Because I know that the federal government transfers healthcare funding, and the BC government is not accountable how this money is spent and whether it's spent on home care supports that are not income tested and that are self-managed as they are in other provinces.
Thank you. So far, the campaign has primarily focused its energy on the provincial government and trying to make an impact directly at the province level in order to be able to get the biggest bang for the buck, so to speak. And while I think there is work to be done on the federal level, we have national partners like the National Pensioners Federation and others, Healthy Age Canada, that are, and Costco helps to represent the work that they do at the national level, making this a federal issue as well. But the focus of this group is provincial and trying to make policy change that can be reached and can be achievable in comparing to the other provinces that have already implemented the same changes. So we're trying to keep it doable and something that we can actually change from policy direction.
Hello. I'm not a senior, but I look. This one here, sharp as a tack. Thank you, ma'am. I would like to attain that, yeah. I live in Fraser Health, so there is life east of Boundary Road. And I look after my mom who lives at home. She's 94. She has moderate to advanced vascular dementia. And she's bedridden. And I have done everything possible to keep her at home where she wants to stay. My dad is 99 and he is in long-term care in Coquitlam. So I've been dealing with one or more levels of bureaucracy for a good 6-7 years. This is going to be an unhelpful thing to say, but it's just an observation. There is no incentive for real change to happen. The government could make it happen in 1, 2, 3 years, but there's no incentive. They want you to give up so that you lose hope. The only way I'm able to do this, I said, I'm going to fight for my mom and dad and make people accountable to the promises they make. They promise all these things. We can do this for you at home support. We can do that. We can do that. Oh, okay. Can you do this? Oh, sorry, you don't qualify. Oh, or you don't return phone calls. So then the onus is on the advocate or the senior to keep calling. And then they get tired or they get sick and they don't call. And then the office can just say, well, look, they never followed up. There's nothing we can do. But that's by design. It's not it is an institutional failure, but there's a purpose behind it. So that's my observation. I'm just a tradesman. I never went to school, but I had to figure it out.
Sure, I'll thank you for. Pardon me?
The good work is important.
Thank you.
But at the ministry level, this is the observation I see.
That's why we're a historic group working together to try to bring about change at the governmental level, because nothing like this has ever been achieved in the province in order to be able to have this many organizations working at the grassroots level to be able to bring governmental change when they've been resisting. I think one of the important things, and I'll be turning it over to Marie Noel Campbell in a moment from the Executive Director from Seniors First BC, but I want to share with you that I appreciate the value and the advocacy that you're doing on behalf of your parents and the work that you're doing. It's not easy at all. My own experience with my own mother was we had to fight to get her home support. And when we got it, we were able to get 15 minutes at one time, maybe 10 minutes to cover her bathing, her medication management, her dressing, and and basically all of her toileting and making sure that she was cared for. It wasn't enough. It will never have been enough to take adequate care. And the cycle of going to hospital and back and hospital and back for a month at a time, every time she ended up there, was really challenging. I'll ask Marie Noel to respond.
Thank you very much, Jeff. Again, my name is Marie Noel Campbell. I'm the Executive Director of Seniors First BC and one of its staff lawyers. We exist since 1994. Our mission is to promote the dignity of older adults free from abuse of any kind. We have joined this campaign for many reasons. One of them is that we believe that seniors should age at home, age in place, and that home support also prevents elder abuse. As we manage the Seniors Abuse and Information Line, the more support there is for seniors, the less strain there is on people like you, and I want to really acknowledge all the work, the patience, the efforts, and the commitment that you have put towards helping your parents, because not every son is like this. And it is important to acknowledge the work of people like you, like Lisa, like all the family caregivers and supporters. It is exhausting to do this work and to advocate on behalf of your parents and family members as you are doing this in addition to taking care of your own needs. We are here because we are not giving up. This is the start. Jeff Moss and GSA BC and others have been working on this campaign for 2 years. This is the launch with all 7 organizations. We are here united on this campaign, and we will continue to advocate for the needs of seniors and for their rights to age independently at home, because as you've heard, home support is not a luxury, it's a basic need. It is part of healthcare, just like basic healthcare needs should not be based on income. So just to say we have heard you, we will continue to hear those who need home support, and we will continue to advocate. Please write to your MLA, do not give up, and we will continue to engage the community so this continues to bear fruit. Thank you very much.
Are there any other questions at this time? Barb?
I'm Barb Mikulek from the National Pensioners Federation Executive, and we truly support all of this initiative. Home support makes sense, and it's a win-win. If the government understands it's a long-term win, we're aging, we're living longer, and we want to live with dignity. And thank you.
Thank you very much, Barb. Yeah. Sure. So I'll entertain that, and then I'm going to ask Sherry Payne to come up and mention why she and the BC Health Coalition are supporting this initiative as well. So, like I say, a little over 2 years ago, JSA BC, our advocacy committee, which was chaired by Larry Shapiro, and we have other members of it here, and then Howard Glick asking the question in the back. He created an AI video. It was incredible because it showed seniors using AI, and I have to tell you that the advocacy committee and the AI video opened doors for us. It got us to the point where we were able to meet with Dan Levitt, the new office of the senior advisor, or the senior advisor for BC, seniors advocate for BC. Oh man, I always do that. It got us to the point where we were able to meet with MLAs, and shortly after I had started at Jewish Seniors Alliance BC, it gave us the opportunity to establish a battle plan. And that battle plan included meeting with the main parties contesting the 2024 provincial election. And the goal was to try to make policy and have our policy initiative of free home support for seniors in BC become government policy and political party policy. And we were very fortunate because we got onto 2 party platforms, the BC United and the BC Conservatives at the time. And it was quite an achievement to be able to do that as a very small organization working, making incredible work and policy conversations with some major players in BC. It was from that effort that the conversation began, and we continued the momentum to be able to build our conversations with the health minister, with the opposition critic for health, with the parliamentary secretary for health, and we continued to try to meet and lobby and ourselves and Leslie Gaudette from Costco lobbied and went and spoke to both the caucuses of the NDP and the BC Conservatives in Victoria. And the momentum that we built, partnering with our colleagues in the senior space, in the healthcare space, was incredible, and the support that we received for the initiative, because really, who can argue the fact that seniors deserve free home support? And so that work together led us to work on this policy initiative here and this launch today, because it's really important that we have free home support in BC so that seniors living at home can live better, longer, healthier, and with better health outcomes. So that's how it all began. Sherry, why don't you give us a bit of your experience here? Thanks.
Well, good morning, everyone. I'm Cherie Payne. I'm the Executive Director of the BC Health Coalition, and our organization works in cooperation with health organizations across the province to amplify the voices of people receiving care and who will need care in the future. So thanks to the leadership of the Jewish Seniors Alliance and Jeff Moss, we were very happy to work with all of the organizations here today to direct attention to the need to eliminate co-payments for home care. And it was really encouraging to hear all of your experiences this morning and the questions that you've raised. I know that as we write to our MLAs and as we continue with this campaign over the coming days and weeks, we will be expanding the attention to the issue. We will be amplifying your experiences as families who are providing care. And so I look forward to us working together in coalition to make sure that the provincial government understands the need for home care. Thank you.
Hello. This has been a most invigorating discussion, and it's so wonderful to hear the voices of people experiencing the joy and the pain of home support. And I reach out to the gentleman there. I'm also south of the Fraser, but I want to say this, while this is located in Vancouver, we have a provincial reach. As Barb's pointed out, we have a national reach. We work with the Canadian Coalition Against Ageism, the International Longevity Center, on a campaign to get the UN Convention on the Rights of Older Persons. Human rights are important, and I know as I aged, it was quite amazing at age 54 to be told my son would have to sign the lease after my husband died on a car. There's all kinds of stuff out there, and you don't realize it till you get into your retirement years. We are keenly aware of that. We have copies of the Costco News there. It is online, and we work across this province to bring the voices of all British Columbians to the government, and I've just been so happy to work with the leadership of this group, and we'll look forward to your ongoing involvement. We are not finished. We are just getting started. Thanks very much. Oh, and don't forget the photo. Don't forget the photo. So, okay.
Thanks, everybody. That concludes today's event.
Sorry, before we finish, I have a suggestion.
Go ahead.
Based on our own experiences, contact the MLA. A lot of the family members hesitate to send a letter because